Hey, look at us. We're here.
We're here.
Here. Doing our podcast. Welcome, everybody, to all the listeners and all the viewers.
Mm-hmm.
My name is Jackie Walker. I am an RPN and Nursing Division President at SEIU Healthcare, and I'm here with two amazing folks who we're gonna put this podcast together. Tyler, why don't you tell us who you are?
Tyler Downey, Secretary-Treasurer for SEIU Healthcare. Really excited to be here, joined by our amazing RPN leader here, Tracey. So, Tracey, why don't you introduce yourself and tell us a little bit about who you are?
Thank you. I'm excited to be here. Thanks, guys, for inviting me. Everybody knows Tyler, I think, that works at SEIU and is a member. So, Jackie, probably same thing with you. I'm an RPN as well. Been employed since 2004 in an acute care hospital in further north from here.
Mm-hmm.
I was a floor nurse for many years, worked complex care and then surgical, and I've been doing other stuff in the last couple of years, so I get to see the other side of patient care.
Yeah, amazing. Well, we invited you, Tracey, because we wanted to just have a casual conversation because you know what's going on in hospitals. Some of our members knows what's going on in hospitals, but there's a lot of people in the public who just don't know. Either they're not getting sick, they have all their family members are well.
So true.
But we wanted to just create this space so we can let your story and other folks' stories be shared so that folks can know what the heck is really going on in healthcare.
Awesome.
Yeah, maybe if we did it because I think there's a part of it that I think people know. I think there is an awareness, but I think what I really try to understand myself is how much do they care?
Mm-hmm.
And maybe if you could imagine one thing that in your day-to-day work that you go through that's the most challenging. What is that one thing?
Staffing is the huge part of hospitals, I think, anywhere, and certainly ours too. The other day when I was in, there were 2 floors that didn't have any registered staff for the next shift.
Wow.
And I've never heard that in my 20 years of nursing.
Wow.
And that's scary.
Absolutely.
And I even said to my family, could you imagine if your family was in a hospital right now? It's scary.
Mm-hmm.
It truly is, because people can't find staff to work, chronically low wages, and just everything the last couple of years has caught up with people and they're done, right? Overtime is not worth it anymore.
Mm-hmm.
People just don't want to work.
So 2 units in the facility.
Mm-hmm.
There was no registered practical nurses, no RNs.
Right. Yep. No
So
registered
who the
staff.
heck is there?
It's a good question. Yeah, that's a good question.
Wow.
Yeah, I wondered the same thing. I'm sure they found staff, and the thing is too, people now are just a number, right? You go into work, you never know where you're going to end up, because that's the thing, is because there's no staff. They'll put you somewhere where there's no staff, even though you don't know the floor itself, and that puts you and your license in jeopardy, right? Because
Absolutely.
you don't know how to care for that patient appropriately. You certainly don't have the knowledge, skills, and judgment to to see what is going on with them, and if there's any acute changes, how would you know? Because that's not your area of practice, right? Aside from the standard stuff, of course.
Right.
But that, for me, is the most frightening thing, I think.
Is that a general feeling about being a number? Is that how your coworkers and you feel mostly on a daily? Is that
Most definitely.
Yeah. And why?
Why? Because there's not that respect there anymore of, you're hired for this floor. This is, you belong to this floor. You have your work family. Because aside from your personal life, your work life is your second family.
That's right. Yeah.
Right? When you're put all over the place, you don't know any of those people that you're working with. Number one, so that creates a lot of stress for people. Number 2, why do you even want to go into work if you're going to be somewhere else that puts you out of your comfort zone and risk your license, right?
Yeah. Really a lack of trust when
Absolutely.
you're just thrown out there and
Absolutely.
You're caring for people's lives.
Absolutely. And I think most facilities have a code of conduct, and ours certainly does. And one of the keys is respect all and protect all, right? And we unfortunately don't see that happening
Hard to
to the staff. Yeah. So a lot of people, I think, are frustrated. They speak inappropriately sometimes, which is because people speak from the heart, especially when you're angry, Right?
People meaning the workers or
The
like
workers.
the patients
The
or
workers.
families?
The workers. You go into
Okay.
work and you're told you're going to be going to some other area after you've
Yeah.
already come in and, you know, started to get report on your patients so
Yeah.
you can be ready for your shift.
Yeah.
Right? You know, and then they tell you you're going somewhere else. That's incredibly frustrating for people.
Mm-hmm.
You know, and then they don't want to come to work.
Would you say there's a element of fear within the workforce? I mean, you talked about the fear of your
Yeah.
license and
I definitely. I mean, there's a couple of types of fear there. I think, Tyler. Number one is, you know, all the new grads. You know, back in the day, the nurses, the hospitals want experience from nursing as well, right? That's gone out the window because you get who you can get. You know, and so a lot of those new people, the fear for them is not even knowing how to nurse. You know, because it is something that takes time to learn and be comfortable with. You know, and to be able to interact with different types of patients from different cultures and backgrounds and even personality wise, right? You know, so that's a fear for a lot of people. The fear for people that have been there longer and have worked in acute care is, where am I going to be? You know, what am I going to be walking into? What kind of assignment am I going to have? Am I even going to be able to work safely today? Those are all real fears for staff, right? You know, when you always have that in the back of your mind, it's hard to get up and go into for your shift.
yeah,
Absolutely.
must make it challenging to work
Yeah.
in that type of environment and situation when you're sort of constantly under that fear pressure, if you
Yeah.
will, right?
For sure.
Yeah. I mean, I think, you know, one of the things that I think is important for people to hear and hear from you is like, why did you choose nursing? Like, there's, you know, like, I think for some folks, I mean, my aunts chose nursing because back in Jamaica, nursing was the thing. You were
Right.
proud to be a
Yes.
nurse, and it was the thing that when you said you were a nurse, you said it with like a, you know, a posture, right?
Yes, absolutely.
But why did you choose to be a nurse?
Yeah, well, same. I mean, I wanted to take care of people, right? And you know, you'd be amazed at how many patients and family members ask you that same question when you're on shift.
Yeah.
You know, why did you become a nurse? You know, especially if they feel that you're good at your job or a good nurse. You know, they ask because they want to know what got you into the field, right? You know, and yeah, again, for me was, you know, number one, I went back to school in my 30s, and I thought it was a good career, a good stable career, and because I wanted to take care of people. You know, yeah.
What makes you a good nurse?
What makes you a good nurse? I think I can get along with mostly anybody. I've learned to relax over the years and not take a lot of stuff too seriously. I think that's important. You know, as far as you can't get angry about stuff and get your feathers ruffled, because in the end of the day, does it really matter? Right? You know, and I'm talking about like personal interactions. You know, of course, with work and people that are sick, you have to take that seriously. Don't get me wrong, right? But I think that for me makes me a good nurse. And when you have 10 things to do in 30 seconds, I mean, you pick the ones that you can manage, right? You have to be realistic, I guess, about what you can accomplish as well.
Yeah.
You know, and I used to, when I first started nursing, I used to beat myself up all the time about, did I go home? Was I at work today and did I do a good job? And the answer would normally be no, because I knew I didn't, according to what I was taught in school, right? And I mean, it's gotten worse since then, not better. Which is why I don't do direct patient care anymore, because I can't. You know, a lot of people are burnt out, and I was one of them, right? So yeah.
Can we talk about that?
Sure, I'm very open.
You know, the trauma that exists in the profession, the frustrations that you described, but also the emotionalness of the role. That takes a toll on folks. Can you talk a little bit about how over your years, how has that impacted you?
Yeah. I think I'm a lot like a lot of other females in that you do your thing and you get it done, and then you go home and you try and push it down and not talk about it or think about it, right? And eventually that catches up with you. You know, and it did with me. You know, you get spoken too rudely and verbally abused by patients and their family members. You get physically assaulted by patients, you know, and yeah, sure, at the time you can slough it off and say, I'm okay. But after, when you go and think about it, and it all just catches up to you, and sometimes something will trigger something that happened at work when you're not even at work, right? You know, and that's the frustrating part, because for me, when that happens, I feel like disappointing myself because I can't control my emotions that way, right? It doesn't happen often, but it happens a little bit.
Yeah.
You know, so as you guys know, I was diagnosed with depression, anxiety, and PTSD for my job. Okay. PTSD, I tried to have counseling for that, but there was no specific incident.
Yeah.
It was over my years of nursing
Right.
that I couldn't pinpoint one that triggered it, right?
Yeah.
But it's funny because months later, after I had a patient discharged, I saw the family member that had been verbally abusive towards me in another facility, and total anxiety just hit me just like that, right?
Yeah.
And it was just over a gentleman that
What was it
there-
like? What was it like in
Yeah.
that moment?
it was scary.
Yeah.
Scary and frustrating, because I thought, why does a total stranger have that power over me, right? But they do, because when you're nursing, you give your all, you know? And I think sometimes who you are as a person gets lost in that,
Sure.
right? So the frustrating thing, like I said, is a total stranger has that power, you know, and it shouldn't be that way.
I feel like what you're describing, Tracey, is what I've been hearing people talk about as calling it moral injury. So it's not
Yes.
the diagnosis of PTSD
Right.
or trauma. It's a, like, you know, overlapping little small individual events that build up to create these injuries for nurses.
Correct, yeah. Because even food services, the people that deliver our trays, who
Yes.
are often SEIU members, they experience the same thing from patients that we do, right? You know, especially when they go into some of the locked units that are locked for a reason, right? So they still have the same fears that we do.
Oh, absolutely.
You know, even though they're not in direct contact with them for 8 or 12 hours a day like the nursing is, they still have exposure, you know?
The federal government recently announced some funding.
Yes.
You've seen that they were going
He
through
called
the
it an investment.
negotiations, right?
Yes, yes.
Did you catch the PSW part of that funding announcement?
I actually turned it off at there because I got kind of a little frustrated with it, quite honestly,
Yeah.
because it's not just PSWs, and no disrespect to PSWs, they work damn hard for their money, and they do their best that they can for their clients because they truly care. But it's not just the PSWs that are suffering in this; it's all staff, including the registered, no matter what your title.
Yeah, and so, what would you say to a nurse who may be listening in that is maybe thinking about, you know, quitting, or is maybe on the fence? Let's just say they're on the fence. They love the work, but they're just so frustrated and just beaten down. But there's a path for them to get out. And they're toggling between the two sort of on a daily basis. Do I stay or do I leave?
Right.
What would you say to someone who's in that predicament in this moment?
Well, there are two approaches for that. Number one is, why did you originally get into the field? You know, try and think about why you did that, and do you still feel like you are making that difference that you thought you would? You know, the second thing is, maybe you do need a little break if you don't want to commit to work, if you are having nightmares about work, if you know it's waking up in the middle of the night worrying about what you're walking into. Maybe you need to take some time off, because ultimately your mental health is good for your patient.
It's number one, right?
It's number one.
That's something that I heard some nurses saying recently. Like, how about no?
Yeah.
How about I say no for me
Yep.
to protect me? And I think that's something that maybe nurses and
You
even
have to learn to
healthcare
say it a little
workers-
more often.
Yeah, probably.
So let's talk about that though. I think that's a big point here.
Yeah.
Why is it so hard to say no? Why?
Why? Because
Yeah.
you don't want to leave your coworkers short-staffed, because you know what it's like to work short-staffed. You can barely get your work done anyway when you're fully staffed, because workloads are just too heavy, you know, and people are way more acute than they used to be, right? They're getting sicker and they're staying longer.
They come in sicker.
Yeah, for sure. It's a whole cascading effect.
Yeah.
Right? You know, and that's the big thing I think that brings a lot of people in, is you don't want to leave it's the guilt of knowing that everybody else is going crazy at work when you said no.
Yeah. So let's look at the UK example. The nurse is there, right? they took a stand
Yes.
and they said no. In a
Right.
way, they said they gave everyone full notice,
Yep.
months and months of notice,
Yep.
Country was prepared.
and they said we are taking a stand.
I wish we had the power to do that here.
Well, let's talk about why we don't. Is there something that because we just talked about saying no, right, and how hard it is to say no, but I think we all can agree that nurses are at this sort of breaking point, right, in the cycle of their careers. Whether you're a new nurse or whether you're an experienced nurse or whether you're someone in between, there's just so much pressure that you're forced to feel like, okay, am I making a difference still, or should I be looking for something else? And that's probably constant on their mind. And so there are levers
Yep.
that can be used, right? And there are tools that can be used. So I think one of the things that I know we always struggle with is, will the nurses be ready for some action, right? And I want to hear from you on like your perspective and, working with nurses in the last number of years, and what's your perspective on that? Are nurses ready?
I think they're more ready than they ever have been. That's for sure. Again, do I think that most are ready to act? That's a tough question. It comes down to, again, wanting to serve others and help others and be there, right?
There's
And
a piece,
if you
though.
take action, it's hard to do those things.
Tracey, like there's a piece there that, we were talking about you and what you did and stepped away, taking action for yourself. Do you think there's a barrier to nurses saying, for me, I'm going to say no? Like for me, I'm going to take action. I asked because we were talking about fear before too, right? And there's fear amongst like, is my job going to be safe? Am I going to be the only one out there, the only one filing this grievance or workload form, whatever it is?
Right.
What do you think about the fear in people to act?
Well, there's been that shift too, where people used to have a lot of casual or part-time jobs, right? Now employers are hiring full-time, so there's less of that fear for knowing that you're going to have a job, and that you can take some time for yourself, because people have mortgages, people have to pay their bills and live their lives, right? So are you going to be paid while you take some time for yourself to get yourself healthy to go back to work, right? I think that's the biggest fear for a lot of people. The part-timers or casuals, they don't want to report things because they don't want to be seen as the black mark, right?
Not called back. We're not calling you. She complains too much.
Exactly. Or, causing problems. So there's that fear that still exists in some, not as much as it used to, for sure, but that's still out there. A lot of it too, I think, is your work culture and the generations, right? The older generations, you worked. You just you went to work and that was it. Didn't matter what. You went, you did your job.
Do the grind.
Do the grind. Nothing, against the younger generations, but they have other reasons, right? It's not the same.
There's a difference.
There is a difference, absolutely, positively.
I feel like my mom's who's a nurse, like she's the grinder, and I was like, what about my work-life balance? What about at the end of my shift, I don't want to be so stricken with moral injury that I can't go have a good time at 11:01 with my friends.
For sure.
You know what I mean?
For sure. And again, I went into nursing a little bit later, so I didn't worry so much about going out after work or having necessarily, I didn't even know about work-life balance, right? But as they get older, I recognize that it's so important, and I think for the younger generation, they know it's important. They know that they need to look out for number one, which is themselves, and I think they're way ahead of the game in that respect. So it'll be interesting to see what happens with the next generations that are coming in.
We need some like intergenerational,
absolutely,
I don't know, move us all in the right direction.
Maybe we should bring some of the younger generation on the podcast there.
There you go.
Right?
Yeah.
Sure, I think.
Stand it up.
I like that. We're doing this again, right?
Oh,
this
absolutely.
has been a great conversation with you, Tracey, but always talking to Tracey.
Yeah. Well, one more thing I just want to mention as well, because again, I do see from the other side now is back in the day, you know, it was more, okay, we needed an RN and we needed an RPN, you know, and there was really a distinctive place for the both of them. Now, because staffing shortages are such a huge issue everywhere, it's a body. It doesn't matter if you're we call them PCAs, if you're a PSW, an RN or RPN, you're a body there, okay? So in the case where there's maybe no registered staff coming on, they're going to have additional PSWs. But again, you're putting them in jeopardy too, right?
Because they're not regulated.
It's not regulated. Yeah, absolutely.
Registered practical nurses are now going to be able to do like 50,000 new things, right? They've been talking about it for some time, pre-pandemic, but it's like, it's going to be live now once the Minister of Health says, yep, go do it. Like, what do you think about that?
And again, that gives you way more duties, gives you way more power, and with that power, I guess that's probably not the right word for it, because I mean you can put somebody
make major decisions
you can make
without
major
a doctor's order.
Exactly. You can put people in jeopardy, right? So you know, people have to know their damn job to do that, right? And when you're shuffled around constantly, it's hard to get your wings and learn your job properly. You know, so that's a big thing. Especially if they're going to be implementing something like that. You know, and again, it comes down to, are you going to be recognized for it somehow?
Yeah, let's talk about the recognition, because I think that's probably top of mind for many RPNs these days, right?
Has been for years, Tyler.
Yes. So you've got a registered nurse who makes X.
Yes.
Right?
Maybe XX.
XX. Maybe double, triple X.
Triple X.
And you've got a registered practical nurse that makes
X or XX sometimes,
or maybe,
depending on overtime.
Yes.
Yeah.
Not even XY, X.
Yeah.
Just the X.
What's that like in terms of the dynamic there? Because, you know, we were just talking a little bit about the scope changing for RPNs now, but the scope has changed, I would imagine.
It has, huge.
So much,
in my career.
right?
Yeah, absolutely.
And so what's that like in terms of the dynamic there, knowing every day you're, what would you say, 90 to 95% to the RN scope?
Yes.
In terms of the work that you do on a daily basis?
Yes, and making way less wages.
Yeah.
Yes.
Yeah.
That has been a huge bone of contention for years.
Yeah.
You know, I remember when we first went to our different care model, you know, it was where the RPN, our scope was really broadened.
Yeah.
Right? And a lot of the RNs had fear over losing their jobs. Yeah. You know, it's like, we're not taking your jobs, it's a change in a care model, right? Again, because it comes down to that right patient for the right nurse in the right bed.
Yeah.
You know?
Absolutely.
Yeah.
Jackie, we're gonna.
Yeah, I was gonna ask you what that is. There, okay, if there's a difference. There's XXX and there's X, right? Is there a dynamic on the floor there? Like, are you exchanging? You're exchanging patients or shift change, like?
Yeah, we don't see it in where I work, and I haven't heard too much from talking with others that there's that dynamic, I think, but again, I think maybe it comes back to how new a nurse you are, because there might be more resentment for registered nurses to work with RPNs because they're taught that the registered nurse is the be all end all, right? You know, and again, no disrespect, but that's what they're taught in school. And sometimes, again, you know, working on the floors, and we'll have the RN students come in and they'll say, well, what is your role here, right? Because they don't even learn that in school either. So I think that's another huge problem, is staff don't necessarily understand what each other's role is. You know, I'm not saying that happens in our facility, because they're clearly defined, but again, with staff shortages, a body's a body, right?
Yeah, that's right.
There's research to show that like a lot of people don't know what people on their team are capable to do or able to do, right? And it creates like a blurred line.
For sure it does. And again, a lot that can be from a lot of factors, right? Number one is the experience of the staff that's there that day. You know, you're going to have a one dynamic one day and a different dynamic another day, depending on who's working.
Yeah.
You know.
Yeah. Like, which family's coming for dinner tonight?
Yeah. Is that something, going back to the sort of gap between what nurses are trained and educated on in the school system and what actually happens on the floor, and that gap in between, is that something that should be addressed? Because I haven't really heard much people talk about that part of the equation here.
When I went to school, it was always, this is the way that you nurse, and then there's the real world, right? That is still the case.
Absolutely.
And it's hard to teach the real world of how it's going to be in the educational system.
Mm-hmm.
Because, I mean, you don't want to scare people away, number one. You want them to finish their program. But at the same time, it would help them have a better understanding of what they're walking into.
Yeah.
Right? Because I think if you're more prepared up here, going into your profession, you might last a little longer.
Yeah. You know, I still remember, Tracey, one of our first moments together. And, you know, one, I definitely want to thank you for participating in this conversation. It's been really helpful, I think. You know, you as an experienced registered practical nurse have shared a lot and have been, you know, a tremendous asset to the healthcare system.
Thank you.
And have provided an example, whether you see it or not, or know it or not, you provided an example that has extended beyond your workplace to so many. We meet so many people.
Yes.
And people like to dance around things.
They do.
I don't like to dance.
Not Tracey.
Come at me straight and tell me.
Yeah.
And I always appreciated you for that. And, you know.
Thank you. That is one thing I always try and reinforce to the new staff is you got to find your voice, man. Because if you don't, you're going to get walked all over.
Yeah.
Healthcare is a tough profession.
Yeah, absolutely.
Yeah.
Yeah. So thanks again for coming on.
My pleasure.
And, you know.
Yeah. Thank you, Tracey.
Okay.
Always. Always.
Great. Do you have any parting words? Any last words for...
Words of wisdom, I have none.
Well, she just gave some.
Well, you
big
gave a
ones.
whole like half an hour full of gems here.
Oh, God. Just, you know what? Be safe out there.
Yeah.
You know? That's it, because that's what it comes down to.
Yeah.
COVID or no COVID, be safe out there.
Yeah.
Yeah.
Great.
All right. We really hope you enjoyed and learned something from our guest today, Tracey Clausi. We want to welcome you to like and subscribe and make sure you're tuned in so you don't miss the next podcast, which we are calling, I don't know, but we're going to figure it out. So join us next time, and maybe we'll have a name, but we know hopefully we'll have you. See you next time.